I'm Dr. Timothy Johnston with your post-op instructions for a routine, uncomplicated implant placement. Number one, you left the office with some gauze that you were biting on. We want you to keep biting on that for about 2 hours. Change that gauze out about every 15-20 minutes with the new gauze that you were given, just to help promote a blood clot and keep the stitches together. Additionally, you were given a shot of steroid, if you were seen at my office, a little dexamethasone, which will help with the inflammation as well. The key to pain control after an implant placement, or any surgery really, is to maintain a handle on the inflammation or the swelling that you would get in the site. If you control the swelling, you control the discomfort. So on top of that, you can also ice the area down, again for about the same amount of time as you're biting on the gauze, a couple of hours. You give the body a break every 10 minutes or so, 10 minutes on with the ice and 5 minutes off so you don't freeze your face off. Additionally, if the bleeding seems to want to continue beyond that 2-hour mark, you might consider taking a tea bag. Black tea works best, but green will do. Dip it in some nice cold water, wring it out, and then put it over the surgical site and bite on that for about half an hour. The natural tannic acid in tea leaves is a great promoter of blood clots, and you'll find that does a great job. If you are taking a blood thinner, whether it's Coumadin, warfarin, or one of the fancy ones, or even just an aspirin a day, you'll find this to help quite a bit. We don't usually take patients off of their blood thinners for a simple routine procedure like an implant, so you might find that you need a tea bag to help get things under control at the end. The number one thing to do for the next few days, the next week or two, concerning healing from an implant is let it heal. In other words, try to leave it alone. Just let it be. Number one on the list, no smoking. If you can at all avoid it, just don't smoke for a few days. Maybe it'll be the first part of quitting smoking, and that would be wonderful. But smoking inhibits the red blood cells' oxygen carrying capacity, so it really slows down healing, and we need for your bone to heal. Begin brushing again in a couple of days, but avoid the area right around the incision, again, just for a few days. Begin eating kind of normal food again, as long as it's soft. In other words, don't go in for the steak or the Dorito chips or, it's something crunchy and hard. No pizza where the crust is cooked nice and firm. Go to cool, soft foods, but maintain a diet. You don't want to get dehydrated or malnourished because you're avoiding eating. And that doesn't mean you have to eat mashed potatoes for 2 weeks either. Think of things like pasta and Italian foods, breakfast for dinner, quiches, things like that. Soft fish. I mean, there's a lot of great food that's nutritious, that's softer. Aim for that for the next couple of weeks. If you are a denture wearer, go ahead and wear your dentures starting about 2 weeks later if you can keep it out for that long. If not, then if you have to put them back in, remember they're not for chewing with, nothing firm anyway. You want to maintain a diet very soft. Fish, bananas, things like that, cooked vegetables, all really kind of really cooked vegetables. If you need to keep them in. If you can keep your dentures out for 2 weeks, all the better. Medication-wise, it's going to be a little sore. After all, we did surgery and placed an implant in there. So 2 things to know about medications. Number one, you're going to need to be on an antibiotic after having an implant placed. That's because the mouth is a cesspool. Sorry, there's bacteria in our mouth all the time. Even with you rinse with a mouthwash, there's still bacteria in there. So you're being put on an antibiotic to control the bacterial level. Secondly, to keep the soreness at bay, I want you to do our over-the-counter pain control management regimen. And that's going to be to take 2 extra strength Tylenol and 3 ibuprofens. So that's going to be 1,000 milligrams of acetaminophen, Tylenol, and 600 milligrams of ibuprofen, or something like Advil or Nuprin, one of the ibuprofens. I'm not talking about Aleve. Aleve is not Advil, it's not ibuprofen, so don't confuse the two. But if you take those 2 meds together at the same time, you'll find that the synergy between them is like 2 + 3 = 10. And it's very safe to take together for a few days. The Tylenol or acetaminophen goes through your liver to be taken out of your body, and the ibuprofen goes through your kidneys. So you're not overwhelming your system, and it works quite well. If you have stitches placed, which likely you do after an implant, keep in mind they'll be there for anywhere from a week to 10 days. Try not to play with them with your tongue or pick at it. If one of them starts to come loose and is annoying, give us a call at the office and we can take care of that for you. Same goes for any other complications. If you are having anything that sounds out of the ordinary or doesn't fit in the instructions I just went over, please call the office. We'll get you in right away, take a look, and make sure that you stay comfortable and that the implant is doing well and healing properly. Thank you for listening.